It's heart-wrenching to realize that dementia, once thought to be a condition affecting only the elderly, is now increasingly impacting much younger people, and experts are sounding the alarm. But here's where it gets controversial. While dementia remains more common in older adults, cases in those under 65 have skyrocketed, forcing us to rethink how and when this disease strikes. Traditionally, Alzheimer's disease, the most prevalent form of dementia, has been seen as primarily affecting seniors. Roughly 1 in 14 individuals develops Alzheimer's by age 65, and this rises sharply to 1 in 3 by age 85. However, doctors are now witnessing a troubling rise in younger patients exhibiting signs of dementia, which has experts questioning what's behind this shift. In fact, the number of dementia diagnoses in people younger than 65 has more than doubled between 1990 and 2021. Research shows that once you pass 55 years old, your lifetime risk of developing dementia could exceed 40%. And it's not just Alzheimer's. Less familiar types like frontotemporal dementia, known to affect people as young as 40, are also becoming more frequent. At the largest dementia conference worldwide this past July, neurologists shared their growing concern. Patients in their 40s and 50s are walking into clinics because they can no longer keep track of their schedules or remember where they placed everyday items like keys. But why? These specialists suggest part of the surge comes from younger generations being more proactive about testing, often because they have a family history of dementia, prompting earlier diagnosis compared to previous eras. Yet they warn of a deeper issue. Chronic illnesses and lifestyle factors common among younger adults, such as diabetes, obesity, depression, and chronic stress, might be fueling this early onset. Dr. Adrian Owen, a cognitive neuroscientist and the chief scientific officer at Kreos, a dementia detection firm, explained to the Daily Mail, "We're seeing younger patients and a greater variety of dementia types. The conversation has shifted from Alzheimer's alone to acknowledging frontotemporal, vascular, Lewy body dementia, among others. Each presents subtly different symptoms." To clarify for those new to this topic, dementia isn't a single disease but a collective name for progressive brain disorders that impair memory, reasoning, and behavior. Common signs include forgetting things, poor judgment, confusion, repeating questions, difficulty in communication, taking longer to complete daily tasks, sudden impulsiveness, and problems with movement. Alzheimer's disease affects about 7 million Americans, mostly those over 65. However, around 200,000 people live with early-onset Alzheimer's, which occurs before 65, according to current studies. Dr. Joel Salinas, a neurology expert at NYU Langone and chief medical officer at telehealth platform Isaac Health, also pointed out how dementia can silently develop long before symptoms appear. These conditions often begin 10 to 20 years before any obvious signs. Initially, symptoms can be very subtle, he said. We need improved methods to identify these early clues. Interestingly, both Dr. Owen and Dr. Deegan, Salinas mentioned that younger dementia patients rarely present typical late-stage symptoms like wandering or not recognizing family members. Instead, issues like anxiety and social withdrawal might be the first signs. Dr. Salinas shared, "Anxiety may be an early indicator, either as a reaction to subtle memory difficulties or a direct effect of brain changes due to dementia. Those younger individuals might also struggle with staying organized at work or home, signaling a decline in their working memory. Even repetitive or obsessive behaviors have been observed." Dr. Salinas gave an example involving a writer struggling to find the right words, not just occasionally, but progressively worse over time. He stressed the importance of watching for persistent, gradual changes over months or years, which should prompt medical evaluation. While the exact reasons dementia is rising among younger people remain unclear, lifestyle choices are likely playing a significant role. A 2022 study by the Lancet Commission reported that about 40% of Alzheimer's cases are linked to modifiable risk factors, such as high cholesterol, diabetes, obesity, and depression. Moreover, findings presented at the Alzheimer's Association International Conference revealed that people adhering to strict diet and exercise routines performed markedly better on cognitive tests, suggesting lifestyle changes can mitigate risk. the troubling part. Many of these risk factors, obesity, diabetes, chronic stress, are on the rise, especially in younger populations. CDC data highlights that adult obesity in the U.S. has doubled since 1990, with 40% now classified as obese. Diabetes rates have climbed from 10% in 2000 to 14% in 2023, with a concerning 20% increase among adults under 44 just in recent years. These conditions promote inflammation throughout the body, including the brain, leading to cell damage and the buildup of toxic brain proteins that destroy neurons. Owen remarked, "Dementia used to be seen as a mysterious illness, striking randomly, but now the puzzle pieces are clearer. Rising rates of diabetes, obesity, anxiety, and depression among younger people are contributing to more early cognitive decline. Mental health challenges are a crucial, yet understudied factor. Indeed, mental health trends are alarming. Between 2019 and 2022, the proportion of adults experiencing anxiety symptoms rose from 16% to 18%, while depression rates climbed from 10.5% in 2015 to around 18% in 2025. Dr. Owen said, "The current mental health crisis among young adults, marked by stress and anxiety over the future, work, and health, undeniably harms brain function." Dr. Salinas added that increased awareness around dementia and cultural shifts encouraging early evaluation have led more younger adults to seek assessments, even before symptoms become severe. The takeaway? If you're under 65 and notice subtle but persistent changes, such as difficulty concentrating, shifts in personality, or trouble recalling words, it's vital to see a doctor sooner rather than later. Early diagnosis opens the door to better treatment options and potential eligibility for clinical trials. As Dr. Owen summed up, the sooner dementia is caught, the better the chances of managing it effectively. So what do you think? Is the rise in early dementia cases primarily due to better detection, or are our modern lifestyles creating a perfect storm for brain disease? Could society do more to address these modifiable risks? Share your thoughts and experiences below. This is a conversation we all need to have.